Radio Network, playing the sexiest music on the planet.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text 23680.
So cool. Welcome to this Sunday afternoon of Stages of Life Radio. I am Melissa Fox, and we do this for you from 4 until 5 every Sunday. You have a question, a medical question, you want to call in, talk to the doctor, 407-422-1212, or you can text us at 23680, and the doctor I refer to is Dr. David Klein. How are you?
I'm feeling pretty awesome today. It's a
I
great day, actually.
I was going to say, I understand you just came from a couples massage.
Well, it wasn't exactly a couples massage. There were, it was. They couldn't give us a couples massage, so we had two different massages, two different rooms. Although it worked out very, very well. So here we are, Sunday after Biketoberfest. So I went up there yesterday to see what was going on in Daytona, and that is one city that's going to take a financial hit from this COVID. I mean, it was busy enough downtown, but the number of stores that were closed, the number of restaurants that were closed, it was pretty sad. But there were many people there, largely local people supporting the downtown merchants, so it was good to see that. And there's like one big Trump rally. I've never seen anything like it. Yeah, the shops, they were selling T-shirts this and T-shirts that. But instead of them selling the usual nonsense, with the skeletons and the Harleys, these were Trump T-shirts.
Wow.
Trump T-shirts, Trump banners, Trump this, Trump that. There wasn't a single Biden anything up there. It's to the point where it's almost not even fair. It was pretty impressive.
Huh.
So you go to Cabbage Patch and see what's going on there, which is absurd.
Bike week.
And it was all Trump all over again. Signs here, signs there. Impressive. For a state that's supposed to be, on the edge there. I have a feeling it's not so edgy. So, here I am. So I'm wearing my Harley Hawaiian shirt.
I saw that. It's pretty cool.
That's what that's all about. We'll try to get one sometime. I actually got this in Hawaii. They just don't make them anymore or around here. So I bought this in Honolulu. Very, very cool place to go. In any event, so what I want to talk about today was foot pain. Why do I really care about foot pain? Why should you care about foot pain? Because it's a very common problem for starters. There's a whole branch of medicine, a very well-respected branch of medicine, a very old branch of medicine just dedicated to the treatment of foot problems called podiatry. And it's the sort of thing that happens quite frequently. We end up with all manners of foot problems. We may or may not go to a podiatrist to treat them, but the maladies exist nevertheless. These are problems that we tend to experience through life. And so I'm going to go through a few of these things, one at a time. Okay, why? Because it's important for you to understand what this is all about. You can have foot pain. Why? Okay, well, trauma, obviously. We're not going to get too much into trauma because it's obvious. You stump drop something on your foot, you break your foot. Okay, great. That makes a lot of sense. But what do? Okay, you end up with a couple toes that are tingling. They ache in the morning. There's something wrong, nothing wrong. And it could be the first toe, but it's usually the second or third toes. You wake up, you rub your feet. You may feel a little bit better. You may not feel a little bit better. And you think that it's just some kind of peculiarity. It must be arthritis. Must be a tendonitis. It must be. It's got to be something. Well, there are problems that you can have, and when you're aware that they exist, it makes it a whole lot easier for you to figure out what to do about it and to also understand that there are choices in what you can do. So what's this about? So what I'm talking about right now is something called Morton's neuroma. Morton's neuroma is an entrapment of the digital nerves between the toes. So if you look at the feet, okay, as if they were hands. What's the difference? And the difference is an additional set of ligaments that tie the fingers, now called the toes, together so that they don't end up with as much flexibility. But as a result of these ligaments, the nerves passing between become vulnerable to compression. So if you develop arthritis, okay, and those little spaces between the toes start to narrow, it will, in fact, start to constrict those nerves. So then you end up developing this thing called Morton's Metatarsalgia. Morton's neuroma is actually a misnomer. It's not a neuroma at all. It's an entrapment neuropathy. So it's like having carpal tunnel of the toes, if you really want to think about it in those sorts of metaphorical terms. So why do you care about this? Because there are things that you should be considering doing. Well, why is it that if it's entrapped all the time, why does it only hurt some of the time? It's a question nobody ever asks, but they should. Does the entrapment go away? And the answer is no. Well, then why does it hurt sometimes and not others? And the answer is actually very interesting. It's what you eat. Oh. Yeah, go figure this one out. It's what you eat. So let's say tonight, this evening, you're going to have yourself a bowl of spaghetti and meatballs. Okay, if you make it like my wife does, it is tasty, but it's also salty. Okay, and it's the way these things go. The salt is what will nail you. And if you're a girl, it's even worse. So tonight you have spaghetti and meatballs. Tomorrow your feet will hurt because the salt causes you to retain just enough fluid to make the entrapment worse. Why does it hurt towards the end of the day? Because the little bit of fluid accumulates down below. Your ankles swell a little bit, your toes swell a little bit, and the entrapment gets a little bit worse. You know that this is going to happen. Okay, girls are a little bit more blessed in this way to know when this is going to happen because many of them wear jewelry down there that starts to get tight, or they wear shoes, sometimes really goofy shoes, that they can't fit into when they get this way. So when else does it happen with women? Okay, around the time of ovulation and menstruation. Wouldn't you know? Because the kick up in progesterone starts to act like another hormone called aldosterone, and you retain salt. In case you understand how this works, you retain salt, you will also retain water and swell a little bit. Women do this, men to a lesser extent. They do get this way. So Morton's Metatarsalgia. So if you go ahead and go to the podiatrist and you walk in there and they look at you and this erudite manner, they'll hold your foot and squeeze a little bit and then pinch your toes and your eyes will roll around and you'll whistle Dixie, except you can't. So it'll may be some other tune these days because it's not politically correct to whistle Dixie anymore. And they'll say, you have Morton's neuroma. And then they start talking to you about putting needles into it. And then after that fails, and it always does, then they'll go ahead and do surgery on it, which also often fails. Okay, so what's this all about? Okay, they're trying to take this entrapment and fix it. When in fact, okay, the real issue is arthritis. The real issue is inflammation and entrapment to the nerves. So what are your alternatives? Well, you can have it injected. You can have it operated on. Or you can take something like a diuretic. And wouldn't you know it, that typically works. If you watch what you eat, if you do find yourself, let's say, straying because you want to eat something salty, let's call it a smoked ham or something, you are going to have a bad foot day. So you can go ahead and take a diuretic, feel better about it. You may take an anticonvulsant, feel a little bit better about it. Or you can use a topical anti-inflammatory anticonvulsant, and it'll feel better in about 60 seconds. So that's my preferred way of doing it. Not everybody has that in front of them. Not everybody has that prescription available. But the long and short of it is that the use of transdermal anti-inflammatories combined with let's just say anticonvulsants. These are medications that work the nerve, working the nerve as well as the inflammation, and bam, the foot pain gets better if it's due to this type of entrapment. So let's move on to the next most common one. Okay, people say, plantar fasciitis. I have plantar fasciitis. Why? Because my feet hurt. Oh, okay.
Wait, that's not right.
Of course it's not right, but that's what people are led to believe. That's what they're told. And when they look up the doctor website, WebMD, it's got to be plantar fasciitis. Okay, now the plantar fascia, okay, in plantar fasciitis goes from the anterior portion of the heel. That's the portion of the heel bone called the calcaneus that's closest to your toes. All right, there's a strip of tough tissue that goes from there to the other metatarsals up front. And what it does to the foot is it bows it like a bow and arrow. Okay, it gets tight, you get an arch. If it doesn't, it flattens out. As we get older, wouldn't you know it, the feet tend to flatten out. Those ligaments get stretched, they get hurt. If you get pregnant, okay, the ligaments tend to loosen even more. Your foot flattens out. Women learn that their feet get bigger after they get pregnant. Wouldn't you know? And they never shrink.
Really? And on that note...
the women shrink, but the feet don't.
You're listening to Stages of Life Radio on News Radio WFLA Orlando.com and all over the place here. As a matter of fact, if you have a question for Dr. Klein, please get on the line now. 407-422-1212. Or you can text us at 23680. We have a couple of texts in, by the way, so we'll handle that in just a minute. We're going to check, well, let's take care of the sponsors, actually. We'll be right back. Nice. Wow, look at all that. Okay, guys, hey, we're on the internet.
We're on a roll today.
Yeah, you were killing it with the foot thing.
It is really cool. I'll get some really neat ones coming up here in a few minutes.
Oh, good.
Okay, yeah, because there are, in fact, more interesting causes of foot pain. But the common ones are common. And so the thing that's most bothersome to me is that people go to the doctor's office and they've already had these goofy things done. And then it's like, okay, first you have to undo the damage from the surgery, undo the damage from the injections. And the injections do, in fact, do damage. They may be necessary, but you have to understand that there's always a downside to these things. And then take it from there. And some of the cures are very, very simple, and some of them can really be costly, not necessarily financially, but in terms of just downside and damage. So, I've had foot surgery one time, okay, because of something called gout, which we're going to get into in a little bit. Mm-hmm. All right, gout. Okay, of all the things to have, I ended up coming down with gout. So the joint, great toe, became arthritic as a result, and it needed to be cleaned out.
Ish.
Well, it's okay. All right, because it's actually done really well. I had a hard time walking up until this thing was done. But I had to go back one time for post-operative issues. I'm going to go back again for another one because it just doesn't end when the skin heals. Never does. So that is kind of an interesting story.
Hey, I almost lost my toe from frostbite when I was 12.
Well, that's what you get for living up north. You never get frostbite here in the south.
You are correct,
or rarely,
sir.
Anyway.
And as soon as I could skedaddle down 95...
You got the heck out of Dodge?
I was here, yeah. Whoop. We do have a question on the text line. They want to know if you still have to wear a mask if you recovered from COVID or have tested negative.
Cool question. Okay, and the answer is no, you really don't, because it's unlikely that you're going to get it again. Except that you're likely to get yelled at by these terrible old ladies with lousy hair and awful faces for not wearing it. I've been yelled at by these old people. Why aren't you wearing a mask? You're going to kill me. And I'm thinking, heck, if your former dead husband hasn't killed you by now, I don't think I'm going to. So, yeah, you pretty much have to do it only because of social reasons and because of the political climate. And wearing a mask is a religion anyway. I want you to imagine taking a dart, like from a dartboard, and throwing it through a basketball net. Okay, that's about how effective a mask is in collecting viral particles. Just the way these things work. So what does it do? It reminds you not to get too close to that ugly lady next to you with the bad hair. That's what it does.
Can you believe me saying this?
Oh, it's terrible.
Here. She's rolling her eyeballs.
This is the way these things work. Okay, so what do I think? I think not. But you should get something done to make sure that you do have a level of immunity, and it's called a quantitative IgG study.
1 minute.
Okay, it's a $49 thing that we do at Stages of Life. You draw blood. Okay, that's all you do. You draw blood, and you see what the level is of the IgG. So we've actually got our analyzer set up to do IgG quantitatively. And we may be the only ones in the country right now doing that. So if you're able to do this, you can look at the amount of IgG. Having it is cool, but knowing how much you've got, man, that's Klein cool. Then you'll know. Otherwise, you don't.
Fair enough. All right, about 30 seconds till we come back. Duck goes from talking feet to
Yeah,
that's just our.
This is flip-flop country.
Mm-hmm, that's our warning. And flip-flop country is a problem for the feet.
Well, it depends on the type of flip-flops you have.
I guess. So Birkenstock's coming back?
Not my life.
No, Stand by 10 seconds. Welcome back to Stages of Life Radio. I am Melissa Fox, and we are live. We're taking your calls. Yes, we are, about medical questions you might have for Dr. David Klein. Stages of Life Medical Institute is located in beautiful Longwood, right off I-4 and State Road 434. For more information on anything we talk about, nutraceuticals or otherwise, you can go to stagesoflifemedicalinstitute.com or stagesoflifevitamins.com. The doc today talking about foot pain. foot pain. Wow, that's exciting, Dr. Klein.
Well, thank you for saying so. Actually, I see about 60 people a day.
Okay.
Right? Okay, and 3 to 4 of them have some problem with their feet. 5 to 6% of the people that come through the door have some issue primarily that brought them in. Secondarily, then you have the diabetics, you have the folks with B12 deficiency, all the happy metabolic issues that cause this. Thyroid disease causes bilateral foot pain, something we'll talk about in a second. But what I'm really interested in are the sorts of mechanical and physical issues, primarily involving the feet, that will do this. Because so you can keep watch, because nobody really cares about your health but you.
That's true.
Okay, if you don't know what the heck is going on, you are done. And if you think WebMD is the answer, okay, you have fallen victim to the marketing. You have got to do something. There's an old-fashioned technique. It's called reading. All right, you have to read. Read a little here, read a little there. If you want to listen to stuff, you can listen to us. Okay, but this is cut down. So what else will happen in the feet that'll cause pain that you might not know about and you might be interested in finding out about? Something called Tarsal Tunnel Syndrome.
Tarsal.
Tarsal with a T. Now, carpal with a C.
That's your hand.
Hand, carpum. Okay, the tarsus, the foot. Okay, so tarsal tunnel is the area just behind what's called the medial malleolus. That's your ankle bone on the inner aspect down to the heel. And there's a series of nerves that pass through there. Tibial nerve primarily. And so what it does, it passes through a narrow canal under the foot and innervates, wouldn't you know it, the toes. And so it too can become entrapped very much the same way that carpal tunnel does. So you end up with tingling of the feet, the toes. Something's not quite right. It's worse on some days, other days not so much. Sounds a little bit like Morton's Metatarsalgia, doesn't it? And it should, because this is the nerve more proximally. This is working its way up the spine. The symptoms are the same or very nearly. It too gets worse with salt load, wouldn't you know? For the same reason. You absorb the salt, water chases the salt, your tissues swell, but the nerve will swell, but the canal does not. That's like having a ring on your finger, and then you jam your finger, it swells, but the ring doesn't expand. Another type of compression, now, isn't it?
Like
same
Chinese
deal.
food with MSG?
Yes, monosodium glutamate, okay, is in fact a salt.
My dad always said, if you don't have a good shoe, a good foundation, you can forget about the rest of it.
Yeah, it's true of
off
everything,
the
isn't it?
With building a house, anything, you're right.
Everything. If you don't have good tires on your car, I don't care what you've got nothing. And so it goes with the feet. So you look from the bottom and work your way up. So when you're looking at tarsal tunnel, okay, this too is one of those compression neuropathies. Well, what do you do about this? There are people out there that'll stick needles in that, and I used to be one of these people. I don't do it any longer because there are better ways to deal with it. But what causes it? Bilaterally, it happens as a result of hypothyroidism. So bilateral foot pain. Well, it's got to be diabetes. Okay, diabetic neuropathy is what my doctor told me. Hey, Jack, you don't have diabetes. How do you have diabetic neuropathy? No, it doesn't. It doesn't make any sense. Diabetic neuropathy never goes away. This stuff does. It comes and goes, comes and goes. So guess what? Your doctor may be, what's the word I'm looking for? Wrong.
Ooh.
Okay, so why? When you're hypothyroid, the same thing happens in the feet as it does in the hands. Bilateral carpal tunnel syndrome is also a symptom of hypothyroidism.
Oh, it's just fibromyalgia.
Yeah, there you go. Another symptom of hypothyroidism.
We got Kathy on the phone, Doc. Let's go ahead and take her.
Sure enough,
she
Kathy.
is listening from Orlando, and she has a blocked tear duct question.
Cool.
In a
We're running a
6-month-old
special on this.
6-month-old baby.
Okay.
Hi, Kathy. Welcome to Stages of Life Radio. How you doing today?
I'm doing fine. I'd like to thank Dr. Klein for his fabulous show. I really all appreciate it.
Okay, hold on just a second, Kathy. I think we have a loose wire here.
That would explain
so
what was going
we can just be patient with us.
Anyway, you do have the question, though.
I-
A 6-month-old
Okay.
baby has a blocked tear duct.
All right, so so the relay question here, okay, is that Kathy from Orlando has a baby there, 6-month-old, with a blocked tear duct. I imagine the real question is, what do you do about it, and how do you go about doing it? Generally speaking, okay, when you have a child that has either a congenital issue of a duct closure, it's a simple matter of opening it up, and there are pediatric surgeons that take care of this. It's really not a big deal. When I was at Duke, we used to do these things periodically. It doesn't happen very often. The other thing that can happen, okay, is you can end up with a blockage as a result of just material, junk. So before you start going crazy with this, you can go ahead and take a hot compress and apply it over the eye, loosen things up a bit, and see if that settles it down. With a 6-month-old, God bless you. Okay, you're going to have a lot of fun trying to pull this off. So the way I prefer to do it with adults, and it works equally well with kids or children, neonates, whatever it happens to be, is to use a warm washcloth, not hot, not cold, but warm, body temperature, 98 degrees. Just the old-fashioned way you'd be able to put the water on your wrist. If it's too hot, you make it hotter, or a little less hot, whatever it happens to be. And you take that washcloth and you soak it in boric acid solution. And what you do is you go to Walgreens, CVS, Costco, go wherever you want to. Costco, I don't think has it. But you get boric acid. A little tiny jar will cost you about $2, $3 maybe. A big jar, oddly enough, will cost you $2 or $3 too. Boric acid is very, very inexpensive. And you take a tablespoon and put it in a quart of water, hot water. Heat it up, dilute, get it nice and dissolved in there, and then take the washcloth, drop it in there, swish it around, and then apply it over the eye. And what it will do is it will loosen up the tissue around the tear duct and will allow it to drain. It's also a good technique when dealing with a sty. Chalazion is what they call it. It's kind of like a zit in the eye. And so it'll loosen it up, bring it to a head, and then it drains. But this is very, very simple. It's a very, very easy thing to do. You're going to go, well, gee, but it's acid. No, it actually isn't. Not all acids are acidic, believe it or not.
Thanks, Kathy, so much. Her line is now open
Oh.
at 407-422-1212. And the text line is actually got a couple questions for you.
I hate when that happens.
This is Stages of Life Radio, Dr. David Klein, Stages of Life Medical Institute.com. First of all, now we sort of answered this question because we are also broadcasting on the social media live with pictures. If you want to see the doc, you can do that. Just go to social media, one of them, Facebook, Twitter, and search for Stages of Life. You'll find them. This question says, do you still have to wear a mask if you've recovered from COVID and have tested negative?
Yes.
Yes,
okay.
you should.
It depends on what testing negative means to you. If you're PCR negative, it means you're no longer contagious. But if you test negative for IgG, you are still susceptible to getting the illness. So you need to know what you're testing for. So that is where the IgG testing is so important. And again, we do it for $49. It's like the biggest nothing to figure out whether or not you're likely to catch the disease. But even still, you walk around, what are you going to do? But tattoo this on your forehead? I'm IgG positive for COVID, therefore I don't have to wear a mask. You're still going to get the same old people chasing you down, yelling at you, and you're going to make me ill, because it's a religion.
What's wrong with you? Don't you care about anybody but yourself?
Yeah, you must be a Trump supporter.
Oh, boy.
So, okay, you got that right.
Yeah,
Okay.
well, sort of.
It has nothing to do with the mask. Okay, if it were so darn contagious, why is it less than 3% of the population's actually gotten
But
it?
yes, we stray from foot pain.
Can COVID cause foot pain? No.
Yes,
Okay, now we got that answered.
No, there's another question here. It's kind of vague, but it says, any recommendations for alcoholism? Quit drinking?
That's number one. Yeah, actually, there are some things you can do with that. There are medications that are injectable, okay, that will help curb, your desire for these sorts of things. The old-fashioned antabuse, I wouldn't recommend doing. That's, disulfiram is really pretty barbaric. But, okay, there are these agonist-antagonist opiates, actually, that you can use as injections that are very, very helpful for alcohol addiction. There are some things that can be done. Counseling, AA, along with it, because you need both. Otherwise, you'll flip right back into it.
Good advice from the doctor. 407-422-1212. If you want to give us a ring, see if we can get the phone working properly. I mean, it was working. It's just not properly working. Also, 23680 is the text line. Going to get a check of traffic and weather next. Stages of Life Radio every Sunday afternoon, 4 to 5, right here on News Radio WFLA, Orlando. Yay, and we're clear.
Yeah, so I hope if the fellow's still listening on social media, there's something called naltrexone, which we will use to treat opium or opiate addiction as well. But it works for alcoholism. So there are a bunch of things. Nothing works perfectly for addiction. So you have to figure out, like trying to pick a lock, what is right for that individual. So, alcoholism, bad problem. Very, very bad issue. There are some nutritional things you can do, actually. So like for cocaine addiction, This is one I'd like you to look up on the internet. Go to National Library of Medicine, PubMed, PubMed.gov, and look up N-acetylcysteine, or acetylcysteine more properly, and cocaine addiction. So oddly enough, NAC is helpful to help treat that type of addiction. It's helpful for tobacco. It's helpful for eating.
For a hammer toe?
Oh, there we go. We actually have our phones back. Wouldn't you know it? Okay. So if you're thank goodness for that. All it takes is one bad wire, one bad switch, one bad cable, one connector.
Some big truck drives down the street, shakes something loose. It's
Yeah,
true. It's
I
how
know.
it goes. It's weird. You never know, man.
Yeah, lightning strike.
Yeah, that too. Yeah. But no, that was just apparently just a bad cable. And it happens too. All right, so we have
Gerbil.
some questions. Yeah, right, Gerbil. we have some bad Gerbil. We have some questions on the internet here in about 2.5 minutes to answer. Let's see. Amy wants to just let you know that you remain the most brilliant man she knows.
You don't know me very well.
Elizabeth has checked in. She says has a relative with sciatica. I can never say that right. Anyway,
Sciatica.
Yeah, right. She's retired, has rested, taken steroids, painkillers, not abating. Not much in a month. I gave her some Voltaren gel, helped her knee quite a bit, but pain is still persisting. Any suggestions?
That's an interesting thing. Okay, so if you applied Voltaren gel in the lower back and the knee got better, the problem is probably not sciatic nerve. It's probably superior gluteal nerve, which is a nerve right at the hip bone. Not the hip bone as you see it, like where your wallet, what do you call it? Your pocket might be. But in the back there's an ilium. It's this wing of bone. And just over there goes a nerve called the superior gluteal. And when it gets pinched, irritated, or damaged, it will cause pain down the leg, usually to the knee. Sometimes a little bit lower, but usually not lower than that. We use anti-inflammatories for that, and it settles it down. This is one place where a single injection, sometimes a second one, will take care of it. This is a non-life-threatening pain in the butt. That is what this is. So she's got it on one side. Let's say that it's on the right side of her hip or lower back.
Which would probably be why she
Most
thinks
likely.
that's sciatica.
Right. Okay. So it'll hurt getting out of the driver's side of your car or getting into the passenger side because you externally rotate the hip in order to do these two actions. That will drive this nerve nuts. Driving in the car for any length of time will make it worse.
1 minute. Go ahead.
So this is pretty much what you do for it. So anti-inflammatories are useful topically, but the distance it has to get to really settle this down is about 3/4 of an inch. That's a bridge too far for the most part, but a needle will nail it. It takes about 5 minutes. Simple problem.
Sorry. Pretty music.
Makes me want to do the Latin shuffle or hustle.
I know, it does kind of take me right back to college. No, for real.
Oh, medical school for me. Yeah.
Yeah, okay, here we go. 17. Ah, come on, you got 17 seconds.
Gotta
You
love
rushed us. You do not rush us. That is not how it
No
works.
soup for you.
All right. Okay, and here we go.
Now let's try it.
Welcome back to Stages of Life Radio. It's Melissa Fox from Good Morning Orlando here on News Radio WFLA Orlando, helping out the doctor, Dr. David Klein from Stages of Life Medical Institute. Every Sunday afternoon from 4 until 5, we take your medical questions. We've talked so far about foot pain. We've talked about COVID, if you've recovered. We've talked about alcoholism. And now we have a call on the line from Maryland.
Cool. I love Maryland.
Maryland 62. No, not Maryland.
Oh.
Which is a nice state,
I love
very
Maryland.
small. But Maryland, she's actually in a
I'm from Maryland or Maryland.
She's from Apopka. Maryland, how are you? Hi, Marilyn. Yeah, we hear that you have a hammer toe, and you had an operation about 4 or 5 years back, and now it's come back with a vengeance. Is that common? Is that the question?
Yeah, is that common?
Is it common that the surgery fails? And the answer is yes. Does it happen all the time? No, because really what's going on here is it's a contracture, a flexion of the tendons that go down to the toes, and it pulls them inward. So then the toe has it doesn't fold up like an accordion, but it will fold up like a hammer. Okay, so they'll go ahead, they'll cut the ligaments, try to straighten things out, put a pin in there typically to keep it straightened out. But if you don't do anything to keep the muscles from recontracting, then having the hammer toe come back is not uncommon. The problem with a hammer toe, very, very painful, very difficult to wear regular shoes. In Florida, it's not so bad. Apopka is still part of Florida, so it stays nice and warm here. So you can wear open shoes, not have much of a difficulty. But if Maryland were for Maryland, okay, much of the year you are wearing shoes. This would be a bummer unless you wanted to cut the tip off of your snowshoes. So what would I do with this? Given the fact that it's already been operated on once, you're probably going to need to have it redone. And that is a major bummer, but it's what you need to do. They have to go back in there, recut, re-lengthen, if they have to, the tendon so to straighten that toe out. And then, when you start to recover from this time around, you want to make sure that you exercise that toe. Something called occupation. You can either have it done formally or you do it yourself. So when I had my
Why would my podiatrist not have told me that?
I don't know. Why don't you ask him the next time around? And you say, when you come,
a different podiatrist this time around.
Yeah, you need to keep the toe extended. So when I had my toe operated on, okay, so they went in, they opened up the joint, cleaned it out. Okay, the pain was so severe that I couldn't hardly walk. It came to a head, as it were, when I was in Fort Lauderdale giving a lecture, national meeting, and I had to walk from my hotel across the boulevard, the US 1, into the convention center, and I only made it halfway and had to turn around and go back. Yeah. It was so exquisitely painful, and it stayed that way for a couple of years. So what do? When you need to have the surgery, things never are repaired wholly or entirely from surgery. You have to keep things from coming back. The surgeon, I started off in general surgery. Very few things are actually cured in medicine. You control them. If you take out an appendix, the appendix never grows back. Doesn't mean you don't have a problem persisting. The appendix wasn't there or put there for no reason whatsoever. Right. Has a function. So with regards to the hammer toe, you're going to have to go back. I would probably go back to somebody else maybe, somebody a little further up the food chain that is capable of doing redos. Because doing the surgery the first time is fairly easy. Going back takes somebody with a little bit more gray hair, probably.
Thanks, Marilyn, for the call. Her line is now open at 407-422-1212. Operators are standing by.
Yeah, speaking of which, we are really, really blessed. Okay, so now we have Bud Hettinger's executive producer as our co-host here. Yes, so Bud, nicely done, but I had her here.
Had her first. Fair enough. Okay, so with regard to foot pain, I'm one of these people that constantly has minimal feeling, in my feet. I had frostbite when I was about 12 years old.
Okay.
And they threatened to remove the entire big toe on my right foot. As you can see, it's
still there.
here. So I'm a fan of going barefoot. I've lost the toenail twice now on that same toe. My brother says I'm destined to just hack it off. Obviously, I don't like it. So, but I have minimal feeling. So I trip, I stumble into things, I fold over, the toes and scrape the top of my toes. Why do
you suppose that is?
Because I'm an ape.
No. Oh, okay. So certain structures heal better than others. Okay. Wouldn't you know it? Skin, very, very, it's flexible. Mm-hmm. It'll grow back, and if it doesn't, you can pluck some out from someplace else and throw it in there. It's like throwing a piece of sod. It'll start to grow more times than not. Mm-hmm. Okay, tendon, not so much, but the worst of the bunch is nerve. So when you had the thermal injury, okay, you killed certain nerves within the toe. Sometimes they grow back, sometimes they don't. My wife has a similar issue from a fracture. So she has areas of one of her toes, I can't remember which one, that cause her some difficulty. Do they come back? No. I ended up having a similar issue, except it was a hot tub, my sister's hot tub in Phoenix, Arizona. So she didn't really pay attention to the temperature, and it was gas heated. And the tub didn't pay much attention either. So she cranked this thing out, and I kind of jumped in and burned myself up to my knees. So I had second-degree burns. Ooh. Had pain in my feet and calves for it was about 5 or 6 years. It was 10 years before I had feeling come back. So that's the problem. With you, it's unlikely that it's going to come back at all. No, but that's a nerve injury.
Not after the second time when I tripped and ripped the nail off and didn't even know it.
Well, no, and you won't, because the pain fibers, are myelinated. They don't have the protection that the motor fibers have. So when those things get killed off, they very frequently do not come back.
I'm still glad they didn't hack my toe off.
Well, yeah, I mean, that seems a bit dramatic.
Well, it really was. I mean, and as I was 12, and you want to add
body image
you
issues?
You want to hear? Want to hear? Yeah, add insult to injury. Okay,
I can insult you.
No. I'm in the hospital for 7 days. The first day I go in, they're like, "Oh, you might lose that toe," and they're like, "Oh, we can't give you a private room. We're a little busy right now." So they stick me in a room with a lady who just loses her leg from diabetes. She's literally in there trying to get used to a
But
leg
they'll teach
being
you never to get
lost.
diabetes, right?
Yeah, but I'm like, and they're threatening to take my toe. I'm 12, and she's over there going, "Oh, my leg." I'm like,
You know,
so,
it's like being
story.
the veterinary ward. When they remove the little testicles.
No, well, I'm
where
serious.
Where are they? Yeah, that's
Scare the heck out of a little
pretty,
girl.
That's pretty awful. Yeah, well, that's what you get for being admitted to the amputation ward.
Well,
The big A up there. That's they only when you're a hammer, the whole world is nail. You know what I mean? Yeah. So, but foot pain is kind of an interesting issue. Very, very common. We walk on our feet. So they take a beating on a daily basis. Most common place in the entire body to get arthritis is the MP joint of the great toe. That's where you would look at and say, well, that looks like a bunion. When I see a bunion, I see arthritis. You see it there, it's going to be elsewhere. So we have to protect these things. You got to protect the puppies. That's just the way these things work. So what are the sorts of things you can do? 3/4 of my patients are women, which means that they are far more likely to wear high heels than the men.
Jamming their feet into those nasty things just to good for the men.
Yeah. Oh, yeah. Well, and I'm not going to object to that, but you do it all the time. Okay? It's you do it when you expect that there's going to be a dividend for it. If you understand,
payoff.
Close the deal maybe, or
like the way the calves are looking. Huh?
Yeah, make the muscles of the bottom look a little bit better. So when you jam your feet into shoes that don't fit, so this is I go to DSWs the same as so many other people do. What does that mean? It means nobody sized my feet properly. So wouldn't you know it? I've been walking around with the wrong size shoes for about 20 years. Why? Because I was too frugal, to go to a proper shoe store. I went to a proper shoe store when I went to get married. Why? I wanted to get a nice pair of shoes to go with my tux. I told him what size I was.
No, you're not.
Guy says, no, you're not. And so I was like, you dummy. No wonder. Doesn't work. What did I think? I didn't think that maybe I wasn't thinking clearly. Go figure that one out. Smart guy, right?
Oh, my goodness. Hey, if you're looking for rapid turnaround COVID PCR testing, we're talking 36 to 48 hours on average. FloridaLaboratoryAnalysis.com. Again, FloridaLaboratoryAnalysis.com. They have your rapid turnaround COVID testings. This is Stages of Life Medical Institute's radio show with Dr. David Klein. We do the Sunday afternoons from 4 until 5. One more little segment for you, and we'll be right back. You stay right there, and thank you so much for listening to News Radio WFLA Orlando. And we're free for 2 minutes because I didn't fill this break any more than necessary.
I love it.
Got a guy named Rob coming up on the phones in 2 minutes.
All right.
Small vessel heart disease.
Cool. Running a special on vascular disease today, too.
What?
Yeah. All kinds of cool problems coming in today. All well and good. Okay. So what are the other sorts of issues that we're not going to be able to get to today because of the time? Okay. Well, when you're looking at B12 deficiency, not uncommon for people to develop kind of an odd sensation in their feet, like walking on blocks of wood. So you get to blood drawn, okay? Well, let's look at your B12 level. The range, is anywhere from 200 to 1,200 to be considered normal. And I want you to think about that one for a second. That is a huge range for anything. That'd be like me telling you that it's normal for you to be 4 feet to 7 feet in height. Well, congratulations, man. That just nailed everybody that exists other than a few people that might be dwarves.
1 minute.
All right. So let's look at B12 deficiency. You need to have the blood work drawn. You figure out you're in the lowest quartile, and you get some intramuscular B12, and you see how you do. What does it cost? About $10. Okay, so it's a very, very inexpensive test to see whether or not it works. Medicare, they may not pay for it, so you pay the $10. What difference does it make? $10? Okay. So you go to Starbucks, you'll drop more than that for you and your partner to go ahead and get some sweet, fattening beverage.
Soy sauce.
Indeed. I want mine with extra soy. Well, good for you.
I'm not sure why she's playing, but I'm all right with that. Actually, that'll work. Okay, so we've got about 15 seconds left. We got Rob on the phone.
Well, if we have 15 seconds.
No, 15 seconds at a break.
Oh, I see.
Now I have 7 seconds. 5, 4.
I love this job.
Welcome back to Stages of Life Radio. How are you? Thanks for sharing your Sunday afternoon with us here on News Radio WFLA Orlando, an iHeartRadio station. You can find podcasts of Stages of Life Radio on iHeartRadio as well. It's stagesofliferadio.com. Hey, Dr. Klein, we've got Rob on the line.
Okay.
Rob is 54, and he's been diagnosed with small vessel heart disease. He's got some treatment questions. EECP, something's been recommended.
Okay.
I don't know what that is, but those are fun initials to say.
Let's see what he has.
Hey, Rob, how you doing?
Good. How are you?
Well, Rob, what's up?
Well, I had a stress test done. My primary doctor, was concerned about some things on my numbers, cholesterol and lipids and stuff like that over the years, and was recommending a statin. And I had been trying to, I was trying to avoid that. And so I ended up getting a calcium score.
Okay.
That came back 0. And I was visiting with a cardiologist on that, and they went through with a stress test. And the stress test showed that I had some lack of blood flow.
Did they say where?
So they did the CAT scan.
Okay.
And then they I guess through deduction determined that it's small vessel heart disease.
Okay, that's not a diagnosis of exclusion. So what they're telling you is that somewhere along the line you have ischemia in your heart, but they can't really figure out where. There are lots of causes for this. If you have a calcium score of 0, that's you did the right thing with regards to the statins. My calcium score is 0. You don't need to have a statin under those circumstances, but there are things that will cause vasoconstriction, and that is probably what's going on here. So in a sense, you may have something more akin to Raynaud's disease of the fingers involving the heart. The small vessels constrict from time to time, but what causes that? Nicotine can cause it, which is sort of interesting. In your diet, you may be taking something that has a vasoconstrictor associated with it. What I'm going to recommend that you do, or recommend that you try, is a medication called clonidine, Clonidine. Clonidine is an interesting vasodilator. It works not just for the large vessels, but for the very, very small ones. Then there are 2 things. 2. Vancomycin and huperzine. Now you're going to go, what the heck is this guy talking about? Vancomycin and huperzine are phosphodiesterase 1 inhibitors. Now you're not going to be tested on this, but PDE1s. What do these things do? They open up the small vessels in the heart, the eyes, the ears, and the kidneys. So where would you find vancomycin and huperzine? Vancomycin was originally marketed, I think it was like 80, 90 years ago, to treat dementia. And does it work? Yeah, for microvascular dementia. You have microvascular ischemia of the heart. You probably have it elsewhere. So what I'd like you to do, go on stagesoflifevitamins.com. All right, you can buy our stuff or not. I don't care. Don't care. But go on stagesoflifevitamins.com and look for a product called Eyes and Ears. If you just type in eyes, EYES, in the search bar at the top, this product will pop up. Then go to the ingredients, and you'll be able to see what the dosage is of the vancomycin and huperzine. You want to find them both. You take this once a day. That usually straightens the problem out. The second thing you want to take is fish oil, not the prescription stuff that's out there. Just get what we were given, by nature. Fish oil, a good fish oil. Look again at heart, HEART, and soul, SOLE. And it'll show you what needs to be in the fish oil. And when you shop for these things, those are the dosages that you're looking for. What the fish oil does is it decreases the viscosity of the blood, allowing it to pass through. And if you're a guy, okay, odds are greater than 50%, that you're going to be a gearhead. You're going to enjoy cars, and you understand the need to have a good quality oil in your car, in the engine, because it allows the engine to cool. And so when you have viscosity issues, especially up north, like where Melissa got her toes frozen, okay, viscosity, the oil will thicken with temperature, but the oil, your blood, can thicken with certain disease states. So these are the things that you can control with nutrition. This does not need to be that complicated, and it doesn't need to be that expensive. Third thing is called high-dose folic acid. In dosage of 5,000 micrograms or better, it actually reverses the calcium that's in the heart, the calcium in the vessels, not just in the heart, but elsewhere. So in the carotids, but also in the microvasculature. This stuff is very, very expensive. It's about $4 a month. Hyperfolate, HYPERFOLATE, on that search bar. You can get ours. If you can find it, you find it someplace else. I don't care where you go, but you get started on this stuff. What are they likely to recommend? They're going to recommend that you go ahead and have this extracorporeal compression device. Okay, so they're going to hook you up, and it's going to push the blood backwards, and that's supposed to help you. Except you can't take the darn thing home with you, and you can't exist in life with it. People have heart attacks. They end up with strokes, not when they're on these devices, but when they're not. So is it going to open things up like a party balloon squeezing back on? The answer is no. It does not work that way. They're helpful if you're coming off a heart-lung machine after surgery and you need a little extra kick to survive until things straighten out. That works. But in the meantime, huperzine, vancomycin, folic acid, and fish oil. Give that a try and see how things go with it. And you're going to do okay. They're trying to figure out something's wrong, but we got to give it a label. So we're going to call it microvascular, although we can't really see it. So I believe in things you can see, not things you can't see.
Oh, I love texts. I just got one from Charla.
Charla?
Oh, no, wait.
Tell her baby's not mine.
No, it says, hi, Charla. Hi, Charla. Hi, I'm not Charla.
No.
It's Alan with the Florida Democrats.
Oh, what does he want?
Early voting starts this week. Can we count on you for Joe Biden? And sorry, no. Look, and even my option there says sorry, no.
Sorry, no. No, I promise I'll apply the brake in my car.
No, I vote the day of. That's how it works. I'm an American. I'm not a fan of early voting. I want my vote to count. But anyway, 407-422-12.
Well, yeah, going in person is very important. Okay, because who knows whether somebody has already stolen your vote.
Well, that's another thing. Yeah. That's the one way to find out.
That's the only way to find out. You walk in there, you sign the paper, you click the lever or whatever whatever your state is doing.
When they feed it into the machine immediately,
that's it. It's
counted. It's done. It's set. It's not sitting there waiting for somebody or nothing.
Yeah, so some clown that went ahead and printed the darn things off someplace isn't going to steal my vote. Whoever my vote happens to be for, although I think you probably know who it's going to be for.
But either way, as long as you get out there and vote, that's really what counts for me anyway. And I want to do it the day of. So.
Yeah. However, I'm probably going to go Monday or Tuesday, but I'll be there in person. Mm-hmm. It's the same thing.
Will you wear your mask?
Why am I that ugly? Yeah, I'll wear the mask. I'll do what's necessary. But will I like it? No.
Look, when we voted in the preliminary, okay, I asked the lady, the elderly woman not wearing a mask, behind the desk that you sign in at, and I said, I have to take my mask down so that you can verify it's me on my license. Okay. I said, but what happened if I had come in here without one? And she said,
they don't care.
Whatever.
Well, in Daytona for Biketoberfest, okay, there were probably 80,000 people downtown. Not wearing masks. Mm-hmm. Okay, some of them weren't wearing much else either.
You're right.
The cops weren't wearing masks.
Of course.
Go figure. Okay, the only people that were wearing any masks were the Antifa protesters. Little weasels.
Were they there?
No. They wouldn't have survived.
I was going to say.
That would have been it. They would have found them head first in the trash cans.
I'm triggered.
Yeah. I'm traumatized by all of these Republicans.
Hey, if you have any information on anything that's been referenced today, find any and all and more information at stagesoflifemedicalinstitute.com. We've got the vitamin store at stagesoflifevitamins.com. And, of course, course, the testing, too. The rapid turnaround COVID PCR testing. You're looking at 2.5, 3 days?
Yeah, or
tops?
less. If you go to travelpcr.com, we can get it done within 24 hours.
Very
It costs a little bit more, okay? But if you need to go someplace,
Get her done.
travelpcr.com.
That's Dr. David Klein. Check us out, stagesoflifemedicalinstitute.com. We'll be back next Sunday. Same bad time, same bad channel. Later.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com.
This hour, we're having a salute to a recording artist who says that his biggest source of inspiration was the airwaves, Stevie Wonder.
My greatest influence was radio. It was my greatest friend in that I was able